Sorry, working with two cameras. Okay, so again, working on, it'll be a whole course on ACL and meniscus, but she just had her movement lesson, but more so her evaluation and lying and standing. So I just want to go. So one of the things she's like for the first time she's just feeling her feet on the ground. Still pre-op, right? But again, we're just now taking, because I just did all that in standing. She's got the confidence. She knows what the game's for into the foot. The transition. So then see she's transitioning. Not so much that rotation. The rotation I'm still going to look at from here. Right, so now that's where you can see it. The hip wants to stop rotating, so the arm wants to do more, right? And this is where you're going to see the complications come up, because what happens, and this is what I don't like in the babies, right? What do I say? I don't like them when they lie down and their heads are separating from and their arms are going out like that, right? We tend to start doing way too much upper body stuff, right? Instead of that, where she should be able to step out, let's say, if I go too far. She can't do that because of this. The step is too hard with the weight transfer. Why? Because her pelvis is starting to not lock up, but be guarded, right? Now, a lot of people going through this ACL stuff, this is right here where it's going to lock up. So again, shift to the pelvis, right? See, now she's holding her breath and she's locking up with the shoulders. But this is climbing the stairs. So on this side, she's just going like, you know, and holding her breath and doing all of this. I don't want her holding her breath. She didn't do any movement that involves breath as a deviation. But now she's starting to shift, and now her pelvis at least can come over the leg. I am not asking her to step out. She's ready for surgery. I'm not going to add to it, right? But I'm going to come here. Same thing. Now on that side, she's more available. She should be. But on this side, the rotation is more guarded. Right through here, through the knee here. Right? And that's okay. Again, this is a pre-op. I'm not going to ask her to change anything that she's doing between now and surgery. But again, the weight transfer is going to be a big one for this side. The transitional skills is going to be more on this side. Does that make sense? Right? And then the rotation will be throughout her body. But at least we really have a good gauge. See her trochanter, right? Feel that all through here where she's just, so what she's doing is it's sort of like crutches. She's locked herself over there and now she's standing with a lock versus standing, you know what I mean? Like she's just shifting her weight. You and I, we would be hyperextending the knee, slouching over and doing these things. That's gone. So she doesn't have that. So that's really, for her, this is where her post-operative care is going to be the most important. Now, post-operative, we're going to be doing the same thing right away and then getting her going with that. But I'm not looking for, again, range of motion or anything like that. Weight transfer, transitional skills, and rotation. We'll go from there. Thanks.